Hello, my name is Jay Christiansen, and I'm the Health and Human Sciences educator with Purdue Extension in Vigo County. And welcome to our next installment in our food prescription program video series called Finding Your Balance. Today, we're going to be talking about stress and how we can find our balance. Over the last week, month, 6 months, or year, how many of you felt so stressed that you have been overwhelmed or unable to cope? Stress is the trash of modern life. We all generate it, but if you don't dispose of it properly, it will pile up and overtake our life. Stress is our body's natural reaction to any kind of demand that disrupts life as usual. In small doses, stress is good, but there's also bad stress. Feeling stressed for too long, whether for several hours, days, months, sets off our body's warning system of physical and emotional alarms. As you take a look at the continuum on the screen, where has your stress levels been over the last couple of weeks? How does that compare to the last 6 months or even year? As we look at the continuum from left to right, with 1 being the lowest, the number 1 can represent happiness, cheerfulness, and enjoyment of life. 3 to 5 represents an area where we feel that we can handle stress and think of positive solutions to the challenges that we face. To all the way to the right at number 10, where I can't handle this. If you would take a look at this continuum, where would you put yourself? How can we live in the low stress zone? If you find your stress levels to be in the high stress zone, what can you do to bring your stress levels back into the low stress zone area? What stress reduction activities can you do? Your body's stress warning signs tell you that something isn't right. Much like the glowing orange check engine light on our car's dashboard, if you neglect the alert sent out by your body, you could have a major engine malfunction. Stress that is left unchecked or poorly managed is known to contribute to high blood pressure, heart disease, obesity, diabetes, and other health factors. When things aren't going your way, or you feel like you're losing control or are overwhelmed, pay attention to the warning signs that we will discuss in the coming slides. They are just some of the ways that your body is telling you that it needs maintenance and extra care. So let's take a moment to reflect on our own stress and recognize and understand the symptoms we feel when we are stressed, frustrated, or overwhelmed. How do you feel when you are stressed? What stress symptoms have you felt in the past or do you have currently? As we examine our own stress symptoms, we can divide them into 4 categories: physical, mental, behavioral, and emotional. First, physical symptoms. Physical symptoms that we may encounter are headaches, tension, fatigue, rapid heart rate, insomnia, weight change, appetite change, or muscle aches. Next is mental symptoms, such as hopelessness, negative attitude, feeling of emptiness, distrust of others, poor concentration, loss of direction. Behavioral stress symptoms may include poor eating habits, foot or finger tapping, nail biting, grinding teeth, restlessness, lashing out at others, having fewer contacts with friends, or an increased drug and alcohol use. And our last stress symptoms are emotional. Examples might include feelings of anxiety, being frustrated, easily discouraged, being lonely, or mood swings, or seldomly feel joy or happiness. Over the course of this presentation, we will talk about strategies to help decrease these symptoms and bring your stress under control. If you recognize that you feel stressed frequently or have noticed that your stress symptoms have increased, please seek medical care from your doctor. In a 2017 Gallup poll on stress, researchers observed the following information. 8 in 10 Americans are affected by stress. 79% feel stressed sometimes or frequently during the day. Women are more likely to report frequent stress. And 48% say stress has a negative impact on their personal and professional life. As you look at these findings and reflect on them, what do you think it says about stress in America? Everyone feels stress, and we each react to it in a different way. Some may feel like the Hulk and become agitated, angry, or unable to control their emotions. Some may feel like the man in the middle and feel hopelessness, depressed, alone, or easily discouraged, while others may feel similar to the woman on the right, overwhelmed, having frequent headaches, feeling tired, not wanting to be around other people, or that you're done with the frequent stressors in your life. There are three main types of stress: short-term stress, acute stress, and excessive and or chronic stress. Acute stress are the reoccurring situations in our life. Many times we are not aware of these stresses due to their frequency and having them be a part of our normal life. Excessive and chronic stress may linger for months or years and interferes with our ability to live a normal life. Unchecked stress can contribute to many problems and can be dangerous. Stress affects us in many ways. It also affects our bodies as well. It can increase our risk of developing heart disease, having high cholesterol, increase our smoking frequency, lead to physical inactivity, weight gain, high blood pressure, overeating, or other behaviors. Other symptoms that we may feel are headaches, back pain, stomach ache, decreased energy. It can disrupt our sleep and leaving feel us cranky and or out of control. As we look at the different types of stressors on the screen listed in the word cloud, which of these stressors do you experience? Do they occur daily, weekly, or monthly? Do you have just one of these stressors, or do you have multiple? In a previous slide, we discussed behavior choices we make when we are feeling stressed. Those behavior choices can fall into negative and positive self-care behaviors. Examples of negative self-care behaviors are smoking, over or under eating, we withdraw from people, or we have angry outbursts. Examples of positive self-care behaviors include exercise, getting 6 to 8 hours of sleep, being optimistic, and establishing healthy routines. Associated with this presentation, you will find a How Do I React to Stress worksheet. This resource will be listed on the Health Clinic's website where you access this video. I want you to take a moment to think of a stressful situation that you may encounter during the next week, and think about how you will handle it. Here are some tips that you can use to lower your stress as you're thinking about that one stressful situation that you may encounter during the following week. When feeling stress, take a moment to count to 10. Take slow, deep breaths. Meditate or practice positive self-talk. Go for a short walk. If the task that is causing you stress is not urgent, work on it another day. Take a break and walk away from your current situation that may be causing you stress. Listen to music or a podcast. Spend time with a pet, friend, or family member. Work out or exercise. And break down big problems into smaller parts. If we look at the tip to lowering stress that is focused on working out and exercise, there's some additional information that we may consider. Regular physical activity can improve your quality of life and relieve stress, tension, anxiety, and depression. You may notice a feel-good sensation immediately following your workout, and also see improvement in your overall well-being over time as physical activity becomes a regular part of your life. You may see that your mood improves. It'll keep your mind off of cigarettes if you're trying to quit, give you more energy, help to lower your blood pressure, improve your sleep, and help you in many other ways. Additionally, there is also a technique that we could use to reduce our stress, is known as the body scan. To access the file for the body scan, click on the link provided below or visit the website to take you to a 16-minute clip that describes how to perform a body scan. As we wrap up, I want you to think about your stress plan and what you will do to lower your stress in the coming weeks and months. So here are some questions that we can consider. What is my goal? What do I hope to change? Who can help me? What resources do I need to have? And how can the people that I've identified help me to lower my stress? What roadblocks or barriers will I encounter along the way? And what stress relief methods or stress reduction activities can I use? There is also another worksheet that corresponds with this slide on the health clinic's website called Stress Plan. Take some time in the coming weeks to complete the stress plan and refer back to it as needed. Being in control of your life and having realistic expectations about your day-to-day challenges are the keys to stress management, which is perhaps the most important ingredient to living a happy, healthy, and rewarding life. For more information about Purdue Extension and the programs and events that we offer in our community, visit us on our website at extension.purdue.edu/Vigo or visit our Facebook page at Purdue Extension, Vigo County.